Welcome, everybody, to the CMS Book Club. My name is Roxane Gardner. Today, we are going to talk about the Content Fuel Framework, which was authored by Melanie Deziel. I found it really interesting and gave me a lot of pause to reflect on our own process of creating content and the challenges we faced. So I'd like to open it up for discussion and ask people, what you found curious or what you found helpful, what struck you about what she has laid out in this jam-packed book.
Roxane, I want to give you my reaction first. This is James Lipshaw. I am the Assistant Director of Instructional Design and Media at the Center for Medical Simulation. My first reaction when I got this was this for me? Was this book club designed for me to talk a lot? To give our listeners a little peek behind the curtain here, I am the one who edits these book clubs. And so I apologize both to you and to myself in advance because I feel like I'm going to have to edit myself talking a lot. And I feel like you're going to have to hear me talking a lot. And I apologize for both of those things now because this is pretty much what I do. Different ways that we can create media, different ways that we can get our teaching out into the world. And I probably, therefore, am going to have some spicy takes on the book, which isn't much of a book. And I also suspect that I probably see creativity and ideas slightly different from the way that other folks do, especially folks who came up in more of a STEM, science, medicine, nursing, engineering path versus me who's gone to art school 2 times.
Great. I can't wait to hear.
I can chime in too. This is Grace Ng, Senior Director for Faculty Development Programs at the Center for Medical Simulation. And I am a nurse and a midwife by training. So as James said, my background is STEM and clinical. And I know for sure in my own training, I had no formal education about creating content. I found this book about 3 or 4 months ago because, as James said, I was looking for ways to, put our teaching out in the world, especially knowing that so many people are looking for a roadmap to do excellent simulations to make a high impact in their organization. And we have so much to offer. But knowing that I don't have any formal training, I was looking for something basic enough to educate myself. And I found this book. And for someone at my level, with my background of no media or artistic training, I found this to be very informative and right for my level. And first, I was looking at this content from a viewpoint of how do I create engaging and meaningful content for people who are interested in simulation. But as I read it, I guess I could not help it. I was starting to look at it from the lens of an educator. How do I get learning out into the world? And I found it to be extremely informative. And then found myself thinking of it from a standpoint of a researcher, especially when I got to the focus of data. Like, how do we present data of our research out in the world? I was like, this is so relevant. And then I was thinking about it from a standpoint of a nurse. How do I get what nurses know and care about out in the world? And that was very informative as well. So I think this has multiple layers that I did not expect when I first picked it up.
Putting the two of you together, I just want to say I thought this book was suggested for me by Grace and Lon because I needed to be a little bit more creative. So it's so funny, our different interpretations of why the book was suggested. But I was really appreciative as I read through it. Yeah, it is a very easy to digest way to think about creating content. And I think from my medical healthcare hat, being an OBGYN, I've done a lot of speaking. So the content I create is very specifically around, disease, illnesses, patients' perspectives. So in terms of that kind of contact, I'm sort of used to, but that more creative way of, pitching your product line and, making the services that you offer more compelling and meaningful or of value to people who come to our website.
Yeah, maybe I can jump in. This is Jenny Rudolph, Senior Director of Innovation at the Center for Medical Simulation. And I wanted to think about the context of this book and how it relates to the work I do and others do, I always find it sort of hilarious when the work I create is called content. You know, it's sort of like when you're an actor and you show up on the movie set and you're like, oh, the talent is here. And I don't mean to equate my content with having talent. That's not the point. The point is, the book is written from the point of view of someone whose job it is to market something. And that person has to go to the content creators and slice and dice that content in interesting ways and or inspire people in interesting ways. So what I found helpful and inspiring here is I can get very stuck in certain formats, which is written formats, primarily about ideas. You know, that's my stock and trade, writing articles, writing blog posts, etc. And what I loved about the book was thinking about a lot of different ways to present what we do, from writing to video to a quiz. I love that idea of engaging people that way, a tool, a map, a timeline. And I appreciated this as a kind of mental unsticker. Like, when you force yourself, how would I convey this in an infographic? How would I convey this in a timeline rather than in a boring paragraph? That's what I found very illuminating.
So I really started to think about how could I concretely apply this to current existing content that we have on our website and make it even more robust or replaced and make it more interactive and compelling and engaging.
Yeah, one of the things that I wanted to see more of in the book, and I'm going to try to invent one myself to fill in this gap, was I really liked the matrix of the 10 different foci and the 10 different formats, but I really would have loved to see more use cases and examples in each cell to spark my imagination. So let me just see if how this lands on you guys. One of the things that we do a lot, I think, at the Center for Medical Simulation is curation. Yeah. In our social media, we read articles, we talk about them, we push them out as like, this is helpful for this, or this is helpful for that. On our community page, on our website, we link people to different simulation societies, different other podcasts, etc. What we're trying to do there, I think, is get ideas out to people, but also make connections among people. But here's a little challenge for us. If we were trying to help people appreciate how to do something, like there's a new article out there or something like that, what could we do besides curation using her different approaches to her different formats to get curated, cool ideas out there?
I think, speaking to what Jenny was saying about different versions of this or combining these things in different ways, for me, what this always comes back to, like, especially in the actual context of our work, like we work for a, healthcare simulation focused nonprofit organization. The point of creating media for us is to both allow folks to access the teaching that we're doing and to promote the teaching that we're doing in various ways. And the thing about the grid, the 10 by 10, where I come up with 100 versions of an idea, right? The job of this author is to create 100 different articles because their job is to be a writer of content. The content of the content doesn't really matter. Their job is to create a bunch of ideas because they're a writer and they have 100 column inches to fill or whatever it is. And as I think about our work, this is something that I've been thinking about sort of more broadly, but it's this idea that I think sometimes folks get content and context confused. And what I mean by that is, in a lighter way, think about someone who you might have heard someone say, like, oh, I would listen to him read the phone book. When it comes to our faculty, when it comes to working with the people we work with, I think to some degree, because of who we are, because of who the people we work with are, anything that we put out there is going to get an audience. And it's a question of how do we make it the most useful version of that? And the usefulness of it is what I really care about. And the reason for that is, if your job is to push out 100 articles, it doesn't really matter whether the articles are garbage or not. like it does in the sense that you want to continue to be employed. You want to be seen as a good writer. You want to do your best and get better and, do these things in the world. But if you're sort of in the engine of content generation, the point is to generate content, not necessarily to generate good content. It's to generate engaging content, if anything, which may be worse than good content in some ways. And so it's a very different operating mode in terms of
Mm,
what are we trying to
absolutely.
accomplish here, because as Jenny said, being sort of reluctant or resistant to being called content. Amazon bought the rights to the James Bond franchise, and an initial huge block was Amazon wouldn't stop calling the James Bond franchise content in meetings with the people who owned it, and they really didn't like that. As you can
It
imagine, if
was
it's
their
something that
baby.
it's their baby. Like, I don't want you to call it content. You're doing this content churn. You're buying up content. In the like art world, in the art academy, the idea in theory is that the thing that I'm making should have value even if nobody looks at it. It should have inherent value. It should be a thing that brings something to the world aesthetically, and content churn doesn't do that. It just doesn't.
Mhm.
Like, you can make a beautiful infographic that influences the world or changes the world or helps the world. I think that's what we're trying to do. I think about the really beautiful New York Times infographic about the way that the coastline of the northeastern United States will be changed by sea level rise at this point and this point and this point. Like, I think that's a really beautiful infographic that changes the way we think about climate change, for example. So that's like doing something effective. That's not content garbage.
Right.
But what I'm always afraid of when it comes to making a bunch of stuff, are you actually diluting your voice? Because there is an attention economy. Are you
Yeah.
diluting your voice? Are you diluting how much people are going to be willing to open your emails if you're just pushing out a bunch of garbage? It's also often my fear around AI, is that we're not actually making more good stuff. We're just making more stuff, and we're making it easier to make more stuff. So you're just increasing the pool of garbage that everyone else has to sort of like get to the surface of.
Yeah, James, that was a spicy take on that, and I appreciate it. I think one of the things that I've learned over the years is when you put garbage in the system, garbage comes out.
Garbage in,
On
garbage
the
out.
other end, that's guaranteed to happen. And I think your comment made me really think about what are some of the ways to make sure our message, I'm not going to call it content by your advice, our message stands out in this sea of content that's flooding social media for busy people who really want to learn and grow and be better versions of themselves, to use our content, to use our materials to make an impact in the world. Like, how do we make sure people see that? I think for me, since the pandemic, I've been obsessed with, making ourselves and making our materials, our message of good judgment accessible to people. I think one of the things that stood out to me is people have been feeling isolated during the pandemic, for sure. And also that persisted after the pandemic is, starting to subside or have subsided as well. And I think what we do as a community of practice connects people. And I really want to focus on making sure people have access to our community and can continue to use our message of good judgment to grow. And in turn, they make networks to connect others. And so I think for me, that's the meta learning that I got from reading this book.
Yeah, layering your mission there, Grace, over or next to the framework. I want to contrast what I think the goal of the book was and then how we are rotating it and looking at it from a slightly different perspective. So she says, this is our author, Melanie Deziel, when the problem when it comes to the task of generating content ideas is that most of us lack a framework for how to think about them. We don't have ready subcategories that guide our thinking and allow us to generate lists of new ideas quickly and efficiently. And what linking her ideas and Grace's point of how do we make work on, for example, leading with good judgment, debriefing with good judgment, feedback with good judgment, or our applied learning for performance and safety ideas of how do you fertilize learning across a healthcare system. Many of us were trained either as clinicians or as academics, so we tend to use a lot of declarative knowledge. We say fancy words in order in an article, or we write prescriptions, or we think of diagnoses, but we don't as readily think and act the way that James's training might be, which is how are we going to do this visually? How are we going to make this compelling? How do we appeal to a different audience? And Grace, one of the areas you and I have been playing around with in this is the idea of bundles. So like there's research on how should we manage sepsis, and that has been promulgated out into the world somewhat more successfully. I know some of my colleagues might contest this, but somewhat more successfully via bundles. Like, how do we do the early goal therapies? And there's infographics and there's things to guide us. So I feel like, Grace, your affinity for things like bundles is a commitment to allowing one kind of content to come into life in a different kind of content. And I wonder if you might talk a little bit about that.
Yeah, Jenny, that's fascinating. I think that resonated with me. I think as a nurse, as an educator, one of my mission is to, I guess, illuminate the pathway for people, if there's a pathway, or if there isn't a pathway, to help create one. And I think bundles help people find a pathway to reach their goals. Like, you know, sepsis bundles help people see a way to quickly manage sepsis to save lives. You know, if there is a good judgment bundle, it helps people find a way to lead with good judgment, teach, coach, debrief with good judgment, the fastest way they can. Yeah, I think I use the word fastest because people are pressed for time nowadays, and I don't want people to be searching around in the dark and waste any time that they don't have to waste. So I think the word bundle, even though it sounds, bundling sounds clunky, like you're like bundling stuff together, that physical act, you know, you bundle it, but once you've like bundled it, it actually makes it more compact. So, you know, I think for me, that's a critically important thing that we need to do. And that's what we're working on.
It's almost a sepsis kit, you might call it, like
Yeah, you
a
can
how do
call
we
it
do
a,
sepsis kit. You know, you have all these things in one packet in one place so that you can just grab them and go.
like that. Yeah. I
Yeah,
like
so
that,
the
James.
content fuel framework that Melanie Deziel suggests is for information primarily, presented in appealing ways. And I think what we're talking about, just because this is what we are about, is mobilizing change in organizations, mobilizing change in the adult learner, creating more psychologically safe spaces. And so when you talk about kits or bundles that way, Grace, your values shine through, in my opinion, which is change, a positive change, adoption of new things, et cetera. It's not just information, it's inspiration or something.
Ooh, I love that.
Love that.
Inspiration, not just information.
In terms of the notions of psychological safety, and thinking about the content fuel framework, it makes me think of, you know, are there more creative ways to promulgate the message of psychological safety in a way that doesn't make people's eyes roll? You know, and there are other topics that are similar that are very important, and once the word gets said, it's like, oh my God, here we go again. You know? So I think in some ways, thinking of the multipliers and combining things in a new and interesting way.
What I really like about what you just brought up, Roxane, is it reminded me of the thing that I found most valuable about the book for me, which is unlocking my thinking. So if you imagine a focus, which is learning the basics about psychological safety or something. So a focus is the basics. And then if I forced myself to do something cute for writing, infographic, audio, video, et cetera, for every one of those regarding psych safety. And these days I could potentially cheat and I know how to write. That's basically the one thing out of all these things I can do. I could potentially use some app like Napkin or something like that to help me create a image, but it would unlock some stuck thinking. I think to see it presented, to force myself to present it in different ways.
Yeah, and I think the benefit of that, Jenny, as you said, is what Roxane, I heard you talking about, I would call it media, right? Like what medium are you using to express what you want to say? Again, this is going back to art school, but the Marshall McLuhan famous line is the medium is the message. At the end of the day, how you choose to say it is what you say.
Is what you say.
In looking at psychological safety, the message across 10 different media, you might actually be informed about like, what of these doesn't make your eyes roll back in your head? Like, what of these actually does work better than an article? So I see it, I think it is useful there, right? It's fascinating to me because, you know, as I was reading this book, I was thinking about the generation of ideas and this suggestion that you could or would want to come up with 100 different ideas for how to do something. And she even says this in the book. She says, at the end of the day, you're really only ever going to need one or two of these.
Right.
And that was the thing that I believed, and so it confirmed my belief, which is like you actually don't need 100 ideas. What you need is one really good idea.
Right.
You need one really great idea, and most people make a career out of one really great idea.
But to have one really good idea, you have to generate a lot of junk ones.
Yeah, you have to shed
don't you have to
99
kiss a
terrible
lot of
ideas.
frogs? Is that like kissing a lot of frogs before you find?
Something like that, yeah.
Yeah, and I think even Melanie makes the point several times, I think, through the book that, you know, the point of the exercise is not about making 100 ideas. It's just that here's how you can think about it so that you don't discount your own creativity, that here's like a place to start. And you know, generating 100 ideas is a fascinating notion. And like you said, James, not all of them, 99 of them are probably going to be yuck. And hopefully one stands out as a shining star that you can really like marshal forward.
I would call it almost idea cynicism. Does come from the beginning of my career. You know, I started my first job out of college was working in Silicon Valley, and it's really like an ideas are cheap environment in the sense that lots of people have ideas that they think are really great, but the ideas don't really matter. What matters is doing the work. Because you run into a lot of people who are like, oh, I have this great idea and all I need is an engineer, like who actually knows how to build it. And you know, so I've based a lot of my career around being a person who actually knows how to make things and do things, because ideas are pretty cheap in that environment. And in fact, cheap to the point of being valueless, because at the end of the day, you have to do the work. There is a great sort of framework that was suggested. I believe this comes from John Cleese from Monty Python. You can imagine that as sort of a very creative group, and now we're sort of talking abstractly about creativity. But he talked about an open mode and a closed mode of creativity, which is basically the idea that in this open mode, you're generating ideas. There's no bad ideas. Come up with whatever you can come up with. This is where these sort of off the wall connections and tangents and non sequiturs and, you know, just insane stuff come from, right? Like this open mode. But then in managing a group of people who are really good at making ideas, you also need a closed mode. And that closed mode is this, we're done with coming up with ideas now. And we're going to take the ideas that we have and we're going to make something great out of them. Because to me, it always reminds me a little bit of coming up with ideas is the like prep for cooking. You know, you're chopping up your onions and you're doing all your mise en place and you're getting everything ready to go. Like you're thinking about what could go into this recipe as you do all these things. But like at the end of the day, you have all this stuff prepped in front of you. You still have to do the work of cooking the meal.
Right.
And sometimes in an organizational environment, what can happen is you've prepped all the stuff, you put it all out, and someone comes in the front door and they said, hey, I just went to the grocery store and I bought a bunch of different stuff. What if we do something else instead? And you're sitting there with all your chopped up vegetables, like, you know, we already did all this work chopping the vegetables. Like, we already talked about what we were going to have for dinner. Do we want to throw all this away and start chopping something else? Like, that's fine. We can have a conversation about it. And so there's this interplay of like, when do we stop coming up with ideas and just do the work and make a good meal?
Jenny, this so resonates with me and my experience of the meeting that we had the other day, you and I went to. We really just like threw it all away and said, okay, we're going to go in a different direction.
Yeah.
Oh
yeah.
my God. Great,
But
great
what
example, James.
what I think is valuable about the open mode versus closed mode, or diverging versus converging, when I heard Melanie Deziel interviewed about how did she come up with the book, she said, I sat in so many content generation meetings, and there'd come a moment where we just had to throw out ideas, and I would just be like, spring, 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 spring. And people couldn't figure out why they couldn't come up with them, and how did I manage to come up with them. And so what I think is cool here is, she took the time to explore her own tacit process, her own tacit knowledge about how does she do it. And this matrix came out of all these things that were sort of implicit in her own brain. But to your point, James, I think if you're new to this, having this format can trigger ideas in the open phase. And that's why I think it's fuel, content fuel framework.
Yeah, I like that, Jenny. I think it provides a liberating structure in a way. It helps you have some kind of systematic way of thinking about ideas. And I think linking this back to James's point, like at the end of the day, someone needs to do the work. And I think one of the ingredients, to go with that analogy, one of the ingredients is the discipline to take the ideas and put it to work. Because even though I've told many people that I enjoy cooking, the act of cooking itself could be quite boring. It could be quite boring. You're just watching the food cook, and you have to wait a certain amount of time. And at some point, it's still a creative process, don't get me wrong, but at some point, you need to eat the food. Someone needs to do that work.
I
So
actually
I think it's a balance. Yeah.
I actually think discipline's the right word, Grace. And I think that's why it's tough and it's not fun. Coming up with new ideas is more fun than doing the work of making the idea and polishing the idea and repainting and changing and erasing and modulating and iterating and all these pieces. Like, it's maintenance work, right? It's fine tuning. It's doing the 80% of the work to get the last 20% of the distance. Like, it's not fun. Like, making something great is amazing and rewarding, but the work is not fun. It's discipline. I agree with you completely.
Yeah, it's discipline, but with respect to your meal, the more disciplined you are about paying attention to the length of time you're boiling something or sautéing something or adding in the spices, the reward is the flavor that bursts in your mouth and the feeling that you get in your stomach when you swallow it. And I guess, for the work that we do, coming up with ideas and then picking the one or two that sound the best and updating a curriculum and coming up with a new activity and then doing the work of creating it and putting it together and piloting it to try to find out, well, where are the glitches and what do we need to fix, and then running it the first time. If it goes off without a hitch, wow, that's like super cool. And if people are really inspired and motivated after that, that's like the icing on the cake.
Like that icing on the cake comment, because it's the best part of the meal.
So Jenny, what are your thoughts?
I was just thinking maybe we should think about application and generalization. Like, given that we have this thing called the content fuel framework, and it has a focus on helping people invent and create content for various things they're trying to push out. But we've discussed ways that we think this might be useful to other goals, such as behavior change and adoption of new practices and so on. I was just thinking it might be fun to talk about how we might apply this in, our work. Each of us might have an idea of something we want to use, or I don't know, something like that.
Yeah, I guess I would jump in and talk about name, claim, aim, for instance. We have that cognitive aid, which is pretty flat in terms of, you look at it, you digest it, but you don't interact with it. And then I was inspired by the emergency medicine physician who created that reel and talked about name, claim, aim. And I thought, well, that was super cool. What if there's a name, claim, aim, something or other that you could engage with, and it could give you feedback or create an interactivity or a guide that was more engaging than just the cognitive aid that you put on your ID badge and then you forget to look at it when you need it.
That sounds somewhat like one of the formats that Melanie talked about, which is a tool, I guess format 9.
Hmm.
So I guess maybe some kind of name, claim, aim generator.
Mm.
Well,
That's
so
a great idea.
what Rob Orman did that I thought was useful and good, and I think it's coming to a question that had been raised here already, is his reel took the time to be persuasive. And what we're talking about is a lot about like information and being informative or being descriptive.
Hmm.
But I think the word he used was puckering, but he described a situation and then described its effect on him, an emergency doctor, as puckering. And so it's like, okay, so what do I do when I'm puckered here? So and then it's name, claim, aim, right? So that's not an informative move. That's a persuasive move. It's
Hmm.
saying like you felt identify with me. You felt this feeling. Like you felt this feeling in this moment of not knowing what to do. Here's an option for you. And so that's a persuasive move. It's not an informative move. And I think that that's maybe the trick here. What we're talking about is still different ways of teaching people something that is information, but it may not be a knowledge problem, right? It may be a knowledge gap into application problem. Why should
Right.
I use this? How do I use
How
this?
do I use it?
I'm fanatical, or I don't know if fanatical. I'm very drawn to practice and repetitions and so on and so forth. So I liked whatever someone said a moment ago about some kind of an image generator. So I was thinking, what if you use the format of an image gallery, which like flashed pictures, and then you had to name the situation as to practice naming, as in naming, claiming, aiming. And you do something very similar to that using our eReal
E-Real.
virtual reality space, Rocks, but it could be, could be just much more rapid cycle.
Hmm.
Um,
That's what I was going to say, Jenny. You're doing sort of a rapid cycle, deliberate practice of practicing name, claim, aim. But again, have we convinced this person they need to use name, claim, aim? How do
right,
we do that too?
Yeah.
right,
We know from adult learning they have to want to learn it.
right. I'm looking at the, like maybe I'm just trying to apply the framework. So a focus could be history or process. Those are two. So imagine if you shared a story of the history of some event gone badly because nobody could really get on top of it because people couldn't name it or decide what was happening, and the emergency devolved in an out of control way. That might be persuasive.
I was thinking of Chris in the Alps program that he leads. And on our website, he has a description of Hospital A and Hospital B. And you read the descriptions. And I'm thinking now, what other format, how can we make that even, become more alive and really elicit that feeling of what it feels like to be in Hospital A versus Hospital B. Um,
Yeah, I think that contrasting storytelling is really effective. Run a simulation, we're pretending it's a meeting, we're talking about how do we promulgate name, claim, aim more effectively. I think that storytelling, that combination of this historical mode Jenny was talking about, okay, we describe a case where this happens this way, we describe a case where this happens this way. We're not even talking about name, claim, aim yet. We're just saying one of these teams is organized, they do this and this and this, they have this outcome. One of these teams stumbles in that organizational moment, this and this happen, they have this outcome. I think that contrast is very effective at saying like, okay, I'm curious now, and that's often the goal of this kind of content, to make you curious. I'm curious now, what was the difference between these teams? And then you
Mhm.
punch them with name, claim, aim, right? Like here's the difference. This team that was effective, that got this outcome, used name, claim, aim. This team didn't. Now let's teach you about name, claim, aim.
Mhm.
Like now you're motivated. Now you, with that moment of curiosity about what is the difference between these organizations, between these teams, between these groups, the impulse of curiosity, the wanting to know more, is your brain saying, I'm willing to learn about this.
Mm.
Yeah, another format that I've seen be effective, one of my coaching mentors in my coaching class, a guy named Marcus Lefton, has a quiz right when you land on his coaching website about what is your life like right now at work. And I could imagine we could have a quiz regarding name, claim, aim. Think of the last time you were in a trauma or a resuscitation or a decompensating patient in the ICU, and answer these questions. Like, did you know who was in charge? What was your heart rate? Would you like to have better answers to this? Check out Name, Claim, Aim.
Yeah, I think to add to this great discussion here, one thing that I wish Melanie Deziel talked more about in her book was the content multipliers. And the
Mhm.
way she described it, she said it's content multipliers of variables that allow you to break apart a single idea and reassemble it in several unique content ideas that can approach that topic in different ways and frame it in different contexts for different audiences. And I think that's the third dimension that is so critical, because exactly like what you had said before, it is helping different audiences look at this content or materials and think about how does it apply to them and how does it apply to people they work with as well. So I think coming back to this idea of name, claim, aim, we have not had a chance to talk about how does it apply to different professions. We've talked about it in the context of teams, but I'm wondering maybe a cohort of nurses who are new graduates might have different uses for it than a cohort of experienced nurse executives in a boardroom environment. And they could both use that. And I think that's what Melanie is talking about in terms of content multipliers. And I think that's critically important. It is the context. And that's what brings relevance to the audience, right? Because James, earlier you said, hey, it's a sea of content that could be garbage, meaningless to people. But once you put in that context, it immediately makes it so relevant as well. And I think that's the hardest work.
Yeah, and
You know,
iterating on a great idea, right? Like in that iteration, what she calls a multiplier, taking something like, say, the good judgment approach and applying it across different arenas, different people, different scenarios, saying, okay, we have this idea about this in debriefing, but what about in teaching? What about in coaching? We have this idea of name, claim, aim, but what about outside of an emergency medicine response to thing? Because the card says on it right now, declare diagnosis, take vital signs, do this and that, like not relevant in the boardroom, like except metaphorically. Um,
metaphorically. Yeah.
but to
It's
create, but to iterate on it and create something that's actually like name, claim, aim for the boardroom, name, claim, aim for the organizational meeting, name, claim, aim for new nurses, and it would be specific and it would be different. And it's five great ideas now rather than trying to come up with a whole new one.
I
Well,
did stumble onto that experience. I had been invited to talk about name, claim, aim to a conference in Italy. And I asked, who's going to be there, thinking, oh, they're going to tell me healthcare professionals. And they said, well, there's going to be some healthcare professionals, but it's going to be a mixed audience. There's going to be people who are, in other uh, science fields, but they don't necessarily take care of patients. Well, when I actually went to do the presentation, there were no healthcare providers. It was all people either in science or administrative positions, deans. And so I had to, think fast and present name, claim, aim in a way so that they could do little breakout sessions right there in the audience and talk about an experience and then apply name, claim, aim to their organizational struggle that they encountered. So it turned out to be, I was sweating bullets, but it turned out to be a really great experience.
yeah, that's great
I love that.
application.
So, well, I love that. I think probably is worthwhile closing out about this time. And I think we had some really great practical generation of ideas for our own selves and our own organization, as well as a really good discussion about the aspects of her book that were meaningful to each one of us. And, James' spicy overlay and, his perspective, I just love it because you're just totally from a different, art world and
planet.
yeah, well, same planet, but you know, and then on the other side, we've got the organizational behavior, and Grace and I represent the healthcare arena quite well. So it's just a fascinating conversation, and I just want to thank you all.
Thank you, Rox.
Thank
Thanks, Roxane.
you.